I will hustle, Mr. Chairman. Thank you very much for doing that. I've been a very outspoken advocate for obviously safety in facilities, all of our long-term care facilities, as all of you have been as well. So I appreciate very much what you're doing for this. But I've also been an advocate to say many individuals in my state, in fact, all the individuals that want it in my state that are in long-term care facilities have already been vaccinated, both the staff and the individuals. Some of them have been vaccinated 5, 6 weeks already, been through the full regimen and been on the other side of it. There's a difficult balance there of trying to provide safety to those individuals, but also about access to their grandchildren, their families, other individuals, school groups that want to be able to come in and bless them. What they've seen is some normal activity in the past around the facility and trying to strike that balance. CDC's put out some guidance. States, including my own state, has put out some guidance on their own. Sometimes they're not lining up. So my question on this is, based on where we are right now, what would you recommend that we put as guidance out for individuals that are dealing with real depression and real isolation in a very difficult season of life already? What would you recommend we start to do right now for those that have already been vaccinated in those facilities? So I'd open that up. Dr. Gifford, obviously you're going to be the obvious one in this, but I'd open it up to anyone else that wants to be able to respond to that as well.
Well, I think, I'm glad you're raising that point. And I think we've all seen this, families and healthcare givers, that when you take a frail elderly person and restrict them from seeing their family and can't participate in activities and see other residents, and really have trouble interacting with the staff as well, because many of them have dementia and they don't understand what's going on, it will have dire consequences with that. And I think the challenge is, when do you balance the safety of a virus that has a 20% mortality risk with the clearly devastating impacts you've had with that? I think we're transitioning out of that, which is good. I think this raises just a broader question about how do we move to providing the care and activities and infection control when you have to restrict people's movements around in a building.
Other comments from other individuals?
Yes, please. I'd like to add to that. I think in large part, I think on the temporary nurse aides and how people have gone and gotten the certification to be able to work in facilities, but may not have all the credentials. I think from a logistical standpoint, just simply put, we could allow families to take these same types of trainings toward infection control and universal precautions, and allow for the designation of an essential caregiver. So they're able to be in there and able to come in and help supplement the care that staff may not be able to provide. A lot of these people were going to see their families daily and weekly prior to COVID. And so I think that's just one of many solutions that we can look at across the board. And we, and working through that, they still be held to the same requirements of staffing in terms of testing and, ideally vaccination.
Others that want to be able to comment on that?
I'll just add that the essential caregiver programs that were just mentioned, a handful of states at least implemented these even before the CDC opened up guidance about visits, and those may serve as a model, as a good model for how we should be moving as a country. Those are programs in which some family members could go in on a regular basis, and they took all the precautions that staff took, and I think those were generally very successful.
Yeah. So would you recommend something like this? And let's get past COVID. We're all looking forward to that day. We're past it in whatever way that looks like for us. We'll have still tough flu seasons in the days ahead. And obviously a really difficult flu can have a catastrophic effect inside of a long-term care facility as well. Would you recommend some of these same processes be carried over into a difficult flu season as well for individuals in long-term care?
Perhaps, but I think it's important to remember that reducing physical risk is not the only goal here. We need to find the right balance between quality of life and seeing family and friends and reducing physical risk. I think the goal is probably not zero risk. The goal is to find the right balance.
I'm glad to be able to hear you say that, because there does seem to be a concern about how do we get to zero risk, and zero risk has a lot of emotional damage on a lot of families and a lot of individuals in their isolation. So many individuals that I interact with will say things like, I have been waiting for 10 months and I've thought in my head over and over, once I get the vaccine, this will be different. And they're experiencing right now nothing different for them, and they've had the vaccine. So they're trying to find some hope in the middle of this as well. So thank all of you for the ongoing work that you've done.